Identify the mark structure. Section of the brain. Yes, of course, you have to learn all the three sections of the brain. ये मैं आपको कई बार कहता हूँ. I told you like many times. Out of the three section, definitely in the exam they'll be giving like one section, and in that section you should be able to identify all the structures. And this is one of the easiest one. That is your corpus callosum here. So option A will be the right answer here. Now moving on to the next one. A 60-year traffic police presented with dull pain in both the lower limb with tortuous vein as shown in the image. Which of the following structure is involved in this one? Obviously, it is actually representing about the varicose vein, and the vein which is involved here will be the great saphenous vein. The great saphenous vein will be involved in this one. Now, identify the mark structure in the given image. In the given image, we are actually learning about the development of tongue. We are learning about development of the tongue. And in the development of the tongue, this one here will be the lingual swellings, which are formed here in the first arch, lingual swellings over there. In between them, this swelling here will be the tuberculum impar. And this one here will be the hypobranchial eminence. इसको हम कहते हैं hypobranchial eminence. So there will be two lingual swellings. In the middle, you'll be able to appreciate the tuberculum impar. और फिर होता है hypobranchial eminence. बेसिकली ये हाइपोब्रैंकियल एमिनेंस फिर से दो पार्ट्स में डिवाइड हो जाता है. एक होता है क्रेनियल पार्ट, वन विल बी द क्रेनियल पार्ट, अनदर वन विल बी द कॉर्डल पार्ट, another one is a caudal part. Now what is going to happen, this lingual swellings and this tuberculum impar, all of them will combine together to form anterior two-thirds of the tongue, whereas the cranial part of the hypobranchial eminence will be forming the posterior one-third of the tongue, and then the caudal part of the hypobranchial eminence, it is the one which is going to form the posterior most part of the tongue along with the epiglottis. So please remember that these swellings here will be the lingual swellings. So in the exam, they have just asked the name of the swellings here. Of course, those will be the lingual swellings.